Good afternoon. Good afternoon to everybody. Okay. Before we start the pep talk, okay, let's have a laughter exercise for about 5 minutes. Please turn on your video, but put on the mute, no sound mode. Put on the video. Okay. If you have a companion with you, please ask him to video your laughing exercise. I'll be your laughing leader or cheerleader. Just follow me. Okay, ready? Please show a thumbs up if you're ready. Okay. So, you just follow me, huh? Okay, 5 minutes lang ito. To energize, let's do this. Okay. Ho, ho, ha, ha, ha. Ho, ho, ha, ho, ho, ha, ha, ha. 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 Ho, ho, ha, ha. Ho, ho, ha, ha, ha. Let's now do a deep breathing exercise. Deep breathing exercise followed by a strong laughter. You just follow me. Okay. So take a deep breath. Then laugh out loud. Very good, very good. Yay! Very good, very good. Yay! Very good, very good. Yay! We are going to have a pep talk in a few minutes. We will be utilizing our brain. Tama? Utak natin. Okay? So just imagine there is a zipper. May zipper dyan, no? On your skull. And then so unzip it, zig, zig. Then open your skull. Kung wari, bubuksan. And then bring out your brain, yung utak ninyo. Put it onto your hand, sa kamay. And then appreciate your brain. Ang ganda pala yung brain ko. Okay? Then laugh out loud. Ha 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 ha. Now let's do it again. Unzip the zipper. Then open your skull. Bring out your skull, your brain. Put it into your hand, then appreciate it. Last one, unzip the zipper, then open the skull, put out your brain, put it into your hand, and then appreciate it. Very good, very good. Yay! Very good, very good. Yay! Very good, very good. Yay! Now, your brain is on your hands. Ang gagawin natin, imamasahin natin, massage. Okay? Then accompanied by a big laughter. very good, yay! Very good, yay! Very good, yay! Your brain is still in your hands. You have to instruct your brain because we are going to have a pep talk. You have to tell your brain to listen attentively, huwag matutulog sa pep talk ni Dr. Joson. And then point a finger. Huwag ka matutulog. Okay. So then laugh. Very good, yay! Very good, yay! Very good, yay! Then take a deep breath again. Deep breathing exercise. Okay, this ends our laughter exercise before we start the pep talk. I hope you're all energized. Okay, your mood has been increased. Okay, so we'll now start the pep talk proper. So I'd like to welcome everybody to this pep talk. As a preliminary, please mute yourself but always show your video picture. Sign in your name, your Facebook account, or email address in the chat box. Please include names of your companions attending with you. Use the chat box to ask questions and make comments and make suggestions or comments while the pep talk is on. There will be group picture at the start and end of the pep talk. Okay. A reminder, please take the online learning cum evaluation test exercise for mastery of learning and have a perfect score to get a certificate like this. The link is already in the chat box. Another reminder, passing or having 50 or less certificates will entitle one to a free voucher for a ROJoson telemedical consultation. Okay, the voucher will look like this. So before we start the pep talk proper, let's now have a picture taking. Please turn on your video. Okay. One, two, three. Okay. One, two, ready? One, two, three. I have a patient empowerment program, which we call PEP, okay, which I like to empower the lay people or patients to take control in the management of their health. There are 3 courses in the pep talk. I completed the core course on October 9, 2021. From October 23, 2021 onwards, I have been tackling health disorder. Sample of courses of disorder course are here. And then health issue courses. So this may take 3 years or longer. So my pep talk today is entitled Low Value Medical Care or Unnecessary Prescription of Medications. This will be part of the health issue course. The empowerment objective is for the lay people to have an understanding of the importance of low-value medical care or unnecessary prescription of medications in the management of their health. The contents of this pep talk will be the following. What is low-value medical care as an introduction to the topic? Okay. What are the different types? What are the causes? How common, and what is low-value prescription of medications? What are examples of low-value or unnecessary prescription of medications? What are the causes and types of low-value or unnecessary prescription of medications? And then lastly, what are my tips on avoiding or reducing low-value or unnecessary prescription of medications? So let's start with the first topic. What is low-value medical care? Low-value medical care is defined as medical care or services, medical services that provide little or no benefit to the patients. They have no potential, or they have potential to cause harm, possible harm, incur unnecessary cost to the patients, and waste limited healthcare resources. So this is the baseline definition of low-value medical care. So when you say no or little benefit, this is in terms of effectiveness. Okay. Thus, not effective in the goal of the medical service rendered. So provide little or no benefits. So not effective in the goal of the medical services rendered. And when you talk about potential to cause harm, this is in terms of risk or unwanted side effects or adverse effects and complications and even deaths with the medical service rendered. Unnecessary cost to the patients is in terms of money spent by the patients and families for the medical services rendered, which is considered unnecessary. Waste limited healthcare resources is in terms of unnecessary usage of a finite government funding budget for health of the citizens like the PhilHealth, and unnecessary usage of finite number of services like hospital beds, tests, and procedures. Low-value medical care can be equated to unnecessary or not needed medical care rendered to patients primarily because of no or little benefit and with potential to cause harm, and secondarily because of unnecessary cost to the patients and waste of limited healthcare resources. Low-value medical care can also be equated to unnecessary or not needed or not indicated or not in the patient's best interest when weighed against other available options. There are always other options available, including watchful waiting, observation lang, and other more conservative measures. High value, to contrast it with low value medical care, high value medical care is providing the best medical care possible, efficiently using resources, and achieving optimal results for its patients. The second topic is what are the different types of low value medical care? So you have unnecessary medications, unnecessary diagnostic tests, and unnecessary operations or surgeries. So low value prescription of medication, which is the first type. This is prescription of medications or medicines that provides no or little benefit to the patients and may be harmful and may incur unnecessary costs and waste healthcare resources. The second examples of unnecessary prescription of medications will be prescribing antibiotics for viral upper respiratory tract infection, okay, prescribing antibiotics for asymptomatic bacteriuria, meaning bacteria in the urine, prescribing vitamins and supplements when they are not indicated. So these are examples of unnecessary prescription of medicine. Unnecessary diagnostic tests, okay, are those physicians ordering for the tests, okay, that provide little or no benefit to the patients, may be harmful, incur unnecessary costs, and waste healthcare resources. Examples will be ordering pre-operative tests for clearance, okay, so yung mga tests before the surgery, okay, prior to a low-risk surgery, okay, so a lot of them are not necessary, okay, ordering MRI. With the advent of MRI left and right now, okay, so a lot of people are wanting and physicians ordering MRI for non-specific low back pain, which can just be observed and just do conservative management. Low value medical care in terms of unnecessary operations or surgeries. So these are performances of operations or surgeries that provide little or no benefit to the patients, may be harmful, may incur unnecessary costs, and waste healthcare resources. So examples will be circumcision, cholecystectomy for asymptomatic gallbladder stones. Asymptomatics mean you don't have any symptoms, it's not causing any problems. Cholecystectomy for gallbladder polyps is also another example of unnecessary operations. The third topic is what are the causes of low-value medical care? There are three factors. The first factor is the physician-driven factors. The second factor is the patient or consumer-driven factors. So patients also play a role. And then the third one is the health system that facilitate the practice of low-value medical care, which may be more intimately related to the physician-driven factor. Example, no quality control in the hospital, incentivization. They may also be related to patient-driven factors. For examples, are no adequate patient education. Physicians are the primary factor because of their greater influence, okay, in promoting and avoiding low-value unnecessary medical care because they call the shot, so to speak. They are the consultants and the recommenders. They are the prime movers and the primary actors. Whereas patients or consumers just follow the advice of the physicians. Thus, they are the secondary factor. Patients or consumers are secondary factor because of their mindset and desires, which physicians want to satisfy to make them happy above anything else, and which usually lead to low-value medical care. So, specific examples or causes of under the physician-driven factors. One is the mindset of the medical management of the doctors. So there's such thing as ritualistic and maximalist physicians. Okay. So these two types of physicians whose minds with this mindset, with a particular mindset, are the is one of the physician-driven factor. Number two is financial gain, either incentivized or non-incentivized, meaning on a personal basis. Okay, meaning the physician has more business sense than compassion sense. Okay. The third one is wish to please the patients or consumers, to please their mindsets and desires over rationalization of care. And then the fourth one will be fear of malpractice suits. And then last one will be no clear presentation and discussion of the options of management. So these are three physician-driven factors. There are three types of physicians based on their approach to medical problem solving and decision making and recommendation. In other words, what are their mindsets? Okay. So one is called ritualist physicians. The other one is maximalist. The other one is minimalist physicians. So take note of that. In this world, in the Philippines, these are the three types of physicians that you will meet. Ritualist physicians are those who make medical management and decision just based on habits and not mainly on critical analysis. They usually lead to low-value medical care. Maximalist physicians are those who institute medical management that includes a lot of things nice to have that are not essential and needed by a patient in health restoration and maintenance. This again leads to low-value medical care. The last one, minimalist physicians, are those who institute medical management that includes only which are essential and needed by a patient in health restoration and maintenance. So these are the physicians who will contribute to high-value medical care. The other two, ritualists and maximalists, they usually contribute to low-value medical care. The second physician-driven factor is financial gain. It can be incentivized, as I said, or non-incentivized, but I'll just tackle the incentivized first. So incentivized by a system in the hospital, in the healthcare institution with rewards, such as stock dividends for the physicians who do a lot of unnecessary or low-value medical care, maraming perks, may free trip abroad, okay, etc., etc. So this is happening in this, not only in the Philippines, but all over the world. The other type of financial gain will be the non-incentivized, but there is also enrichment on a personal basis this time, such as from more revenues, getting more revenues from personally owned. Some doctors own their own pharmacy, so they try to prescribe drugs that will promote their drugstore, or they have diagnostic business also. Okay, they want more revenue from procedures rather than medications, so they would convince you to have the operations rather than medications, even though medications can suffice, etc. So in other words, they have more business than compassion sense. Again, this is a reality in the world. The third factor is pleasing patients on their mindsets and desires rather than explaining, educating, and convincing them on the rationalization of the medical care. The fourth one, physician-driven factor, fear of malpractice suit. If undue development, because no one can assure anybody of 100% perfection of treatment. So sometimes you can have undue development occurring, and when they do, okay, so the doctors are afraid to be blamed for it, okay, because they did not accede to the unfounded mindsets and desires of the patients and relatives. The last one is no clear presentation and discussion of options of management. In terms of BRCA, for those who have been attending my pep talk before, you are familiar with the BRCA. Okay. B stands for benefit. Okay. R stands for risk. C, cost. And then A, availability. Okay. So these are the processes that will be used in the selection of the cost-effective options. High-value medical care looks for the most cost-effective option, not just the effective options. Take note of that. Okay. So we have to input the cost value of all the different options. So this is an example of the BRCA that I was I just discussed. Okay. So as I said, high value medical care looks for the most cost effective. So you have to input the cost. Okay. So example, on the first column listed are either, okay, treatment in terms of medications, diagnostic tests, procedures, then you have these options. And then you compare them in terms of benefit. What are the benefits of this one, benefits of option two, benefits of number three, and then what are the risks for each options, and then what are the corresponding costs for each options, and then how available are they. Okay, so the physician should present data on all these parameters and then advise the patient. The second factor is the patient or consumer-driven factors, which is mindset and desires of the patients. Again, there are three types of patients, just like the doctors: ritualist, maximalist, and minimalist. Okay. Ritualist physicians are those who make medical management decisions just based on habits, fads, and not mainly on critical analysis. So this will lead to low value care unless the doctor will control it. If the doctor cannot control the mindset of the patients, then everything will lead to a low value medical care. Maximalists, those who desire everything nice to have, even they're not essential. Again, this will lead to a low value medical care. Minimalist patients are the best one. Those who desire medical management only that includes those which are essential and needed. So this will lead to a high value medical care. Now, how common are low value medical care? Very common, not only abroad, but also in the Philippines. It has been present since time immemorial, since the start of medical profession, from the before Christ and up to AD, okay, or after. CE means current era, BCE means before the current era. The other terms for that is BCE represents BC, before Christ, and then CE, AD. Okay, so as I said, since the start of medical practice in the world, okay, so when the physicians and healthcare institutions and patients are not yet conscious of low-value medical care, there is now a formal movement advocating high value and reducing low value medical care, initiated when they considered the fundings already. Okay, the fundings of the from the government is being challenged. Now they start thinking about the high value medical care. Nauubos kasi yung funds ng gobyerno. Okay? A popular movement which is called Choose Wisely. They started in the US in 2012. Their mission is to promote conversations, parang ano lang, very diplomatic. They said conversations, okay, between clinicians and patients by helping patients choose care that is supported by evidence, data, scientific data. Number two, not duplicative of other tests or procedures already received. Number three, free from harm. And then truly necessary, talagang kailangan. Okay? So this movement has been spreading globally across Europe and Asia to over 20 countries or more now. Okay? And there is a more formal tracking. If you Google this one, you will see even up to now, now there is a formal tracking of this low value care in hospitals in the USA, England, Australia, New Zealand, to name a few. Okay, none yet in the Philippines. Okay, so they identify hospitals which are using a lot of non-value, low-value medical care. It is very common because in practically all prescriptions of medications, ordering of diagnostic tests, and performance of operations, there is always a potential or risk of low-value medical care because of the physician, patient, and health system-driven factors. I'd like to emphasize, particularly when physicians do not present and discuss the BRCA data and processes with the patients, as seen here on the side of this slide. Now, today I will be focusing on low value or unnecessary prescription of medications. I will discuss low-value unnecessary diagnostic tests and surgeries in subsequent sessions next week. So what is low-value or unnecessary prescription of medications? As I said earlier, prescription of medicines that provides little or no value, one, so remember this four, may be harmful, number two. Number three, incur unnecessary costs. Number four, waste healthcare resources. So how common? As I said, very common, but among the three types, okay, unnecessary medication, diagnostic tests, and unnecessary operations or surgery, low volume prescription of medications is still the most frequent because drugs are the most common and readily available resources used by physicians and patients alike in managing health problems. The second one is the diagnostic test. The third one is the unnecessary operations. What are the causes of the low value prescription of medications? I mentioned this already. The general factors would be the physician factors, patient, consumer-driven factors, and then the health system factors as the tertiary factors. Then the causes for the low-value prescriptions are also the same here. Okay, mindset of the medical management, financial gain, ways to please satisfy the patients and consumers based on their desires and mindsets, and then fear of malpractice suit, and then no clear presentation, discussion of options of management. Okay. The other one is the mindset of the desires of the patients, and lastly, the healthcare system factors. This is allowing, facilitating, and no policing, no quality control of the practices of the physicians. That's one factor. The other factor under health system is the inadequate public health education, patient-centered care management program, or patient empowerment program. So what are the types of the low-value prescription of medications? Okay. So one, it is not needed. Okay. Kung pwedeng watchful waiting will do, then it's considered not needed. Okay. Inappropriate to use. Okay. It's not indicated. Not proven effective. Okay. Unsafe for all patients and to certain patients. Okay. Not all medicines are safe to all patients. Okay. Costlier than other equivalently effective drugs. Sometimes there are 2 or 3 drugs of the same effectiveness, but the physician choose the more expensive ones. Okay, this is under low value prescription, and then being prescribed too long. Okay, too long means 1 week, 2 weeks, 3 weeks, baka hindi naman kailangan. Then too many. When you say polypharmacy, it's already more than 5 drugs at a time. Yes, we have witnessed a lot of patients taking 10, 20 drugs at the same time, right? I'm going to just give few examples. Remember what I said, that this is very common, and in practically all prescriptions, there is always a potential for this raise for low value medical care, particularly when the physicians do not discuss the BRCA processes. So in the Choose Wisely website, you can see hundreds. The last time I saw it's about 600. Okay, it could even be more. Okay. And then some examples that I will just give will be prescribing antibiotics for viral upper respiratory tract infection, prescribing antibiotics for asymptomatic bacteriuria, prescribing vitamins and supplements even when they are not needed, oral antibiotics for ear infections. They would prefer e-drops rather than oral antibiotics. Cough and cold medicine should not be prescribed, recommended, or used for respiratory illness in young children. Okay. So we know that is frequently prescribed. And then for the mga elderly with some mental disorders, so benzodiazepines, antipsychotic use, okay, prescribing 2 or more antipsychotic concurrently. So these are examples of low-value medical prescriptions. Another example will be don't prescribe or routinely continue medications for old patients with limited life expectancy. Let's see, 100 years old already, and then practically terminal or end of life condition already, without due consideration to individual goals of care, presence of comorbidities, and time to benefit for preventive medications. And then do not use routinely prescribe the so-called venous thromboembolism prophylaxis to all hospital patients. This is commonly done now in the hospital. Okay, so they should take note of this. And then do not initiate medications to treat or new emerging symptoms without first ascertaining that new symptoms is not an adverse reactions, event of an already prescribed medications. As we know, there are a lot of patients taking a lot of medicine. So some patients will develop symptoms because of the medicine. So parang reactions. And some physicians tend to just give another medicine for the reactions, not analyzing, not thinking that the reaction is due to the currently medicine that the patient is receiving. Okay. So as I said, I'll just mention a few. Okay, I cannot cover everything. There are a lot, 600, probably even 1,000 if you really dissect it. Okay. So now what are the tips in avoiding or reducing low value or unnecessary prescription of medications? As I said, there are these three factors, but the question is, what can you do as a lay person, okay, to contribute to this advocacy? Okay, so because all of you lay people play a big role here. Okay, so doctors and health institutions are now trying to police themselves because of the Choose Wisely movement that started in 2012, but we don't have it yet here in the Philippines. There are some doctors like me who's advocating this, but we are just a small voice in the movement, in the advocacy. Okay, so how long it will take, we don't know, and how successful it will be, we don't know. Okay, so I think you can do your part here. Okay, because you are the secondary factor, patient and consumer-driven factors. So you can contribute here by doing your part and for the sake of your relatives or your family. So to do this, you have to be empowered as a patient. So try to advocate patient empowerment program, which we are doing here in this program, PEP Talk. Okay. So we know that knowledge is power. It gives power. We have to use the 4 Ks of patient empowerment like kaalaman, kakayanan, karapatan, and kapangyarihan to gain greater control over decisions in the medical management of oneself, ourselves, in promoting high-value medical care and trying to avoid the so-called low-value medical care. So we have to be always in touch with reliable medical information on both the low-value unnecessary and the high-value recommended medical care. So strategies, be constantly aware and vigilant against potential for low-value prescriptions of medications to be done by physicians. Always aim and insist for a high-value prescription from the physicians. Be proactive in controlling and avoiding low-value prescriptions of medications. Make the physicians aware that you know the processes. So after this talk, you know the processes now, okay? So on how to reduce the low value and how to promote high value prescriptions. Then have a shared collaboration with the physicians in accomplishing this. Before accepting the prescription, any prescription of medicine, always ask the doctor, the physicians, ano yung specific diagnosis mo? What is your specific pre-treatment diagnosis, and ask them to quantitate the degree of certainty, because there's no such thing as 100% certainty in all diagnoses. Okay, so hindi pwedeng 50-50, no? So it should be 60, more than 60, 60 to 90, okay, versus 1 to 40, ganon. Okay, primary and secondary diagnosis. Okay, so as for the diagnosis before the treatment, okay, force the doctor to give you the diagnosis. Ano ba yung diagnosis nyo as a starting point of our decision making? And then after that, what is the goal of the treatment? Ano ba yung objective natin? Ano ba yung target natin sa treatment? And then what are the options in the treatment? Okay, can it consist of watchful waiting, observe lang? Okay, baka mawala rin yan, no? Kailangan ba ng medications? Okay, kailangan ba ng operations, etc. Okay. So, is watchful waiting, ito palaging nakakalimutan ng mga doktor, okay? So, is watchful waiting without medications a good option? You always ask that, okay? So, what are the chances that the medical condition or disease will resolve spontaneously? Pag magre-resolve siya spontaneously, and then pwede na yung watchful waiting. So if more than 50% chance, mas maganda kung 90% chance, all the more, pwedeng watchful waiting lang, di ba? Okay. What are the comparative data and information of the various options in terms of benefit, which is equivalent to effectiveness, the risk, the cost, and availability parameters? Then ask him what is his recommendation on the cost-effective options. Kasi kumisan mahirap din maintindihan ito yung mga medical information. So you ask him point blank, what is your recommendation? And ask him, what is your basis? Okay. So the basis should include the benefit, the risk, the cost, and availability. So always use the BRCA process in selecting the cost-effective treatment. Okay. Here we're talking about medication, but this is applicable to diagnostic tests, operations, etc. Okay. Now, if medications will be used, because we're now on the topic of medications today, so ang itatanong, what are the comparative data or information on the various options of medicine? Okay. May medicine 1, medicine 2, medicine 3, okay? In terms of the benefit, risk, cost, availability parameters, okay? And then what is the recommendation of the doctor? Ask him, what is the most cost effective? Always include the word cost. What is the most cost effective? Okay. So this is the table that will illustrate the BRCA process being done. Okay. Then when the physician asks for your response, kumisan, tatanungin ka ng doktor, ano yung gusto mo? No? Okay. Ito yung recommendation ko. I won't force it on you. Dapat ganun sabihin niya sa iyo. But I'll give you a chance to think about it. So when you ask this question, feel free to ask as many questions that you may on the data and information presented. Okay? Ask. Don't be shy to ask. Okay? And also ask him to temper and validate your personal biases. Kuminsan kasi may personal biases din ng mga pasyente. No? I-volunteer mo na. Sabi mo, doktor, baka ito yung mga belief ko, ito yung mga practices ko, can you see whether it's valid or not? Okay? Huwag mo i-force yung mga biases mo, yung mga mindsets mo. Okay? You are free and have a right to seek a second opinion after the first doctor, okay, if you want. Okay. However, when you do this, when you seek another doctor, make sure you follow the same processes that I mentioned above. Kung wala, you end up baka mas magulo pa. Okay? Okay. So I will now give you an illustration. A 30-year-old Filipino female, let's call her Anna, with a recent onset of cough, colds, and fever. I will use an example in the COVID-19. This is very relevant. Okay, so an RT-PCR for COVID-19 showed positive results. Okay, may cough ito, may colds, may fever, and Anna has no comorbidity, very strong. No, okay. So she consulted a physician. Let's say she consulted me, Dr. Ray. Okay. After fully evaluating Anna, Dr. Ray gave a statement of the diagnosis. So Anna, you have COVID-19 positive, symptomatic, cough, colds, and fever, and mild lang naman with no comorbidity. Dr. Ray gave her a good diagnosis or prognosis for recovery. Okay. So Dr. Ray recommended the following management or regimen. Isolation up to a certain date, okay? Body resistance, immunity buildup and maintenance using the ROJoson regimen, which is rest and sleep for 10 hours, hydration, 10 glasses of water, nutrition, balanced, varied diet with plenty of vegetables and fruits, exercise, light to moderate intensity, 1 hour, 30 minutes morning, 30 minutes in the afternoon, stress control, meaning anxiety over the illness, control that, finance, minsan may mga financial problem also, and then human relationship, which can contribute to a downfall of the resistance. Medications only as needed for moderate to severe symptoms. So standby for paracetamol for fever 39 degrees and above and severe body pain. No need for vitamins and supplements. Honey and lemon for colds and cough. Monitoring of temperature, oxygen saturation, if there is a pulse oximeter available, respiratory rate, and symptoms. Okay. So 3 times a day until release from the isolation date. Okay. And then be ready with hotlines for oxygen and hospitals for emergency use. And then report to me every day up to the release from the isolation day. Okay, so this is my regimen that I give. Okay, so the rationale for this regimen, okay, number one, home management, okay, is sufficient, as 99% will spontaneously recover with supportive management. So what is needed though is a close monitoring at home, and hospital confinement is not indicated. Okay, so the low value medical care will be confining mild COVID-19 patients with no comorbidity to the hospital is not indicated. We have heard stories of that, right? Okay, so if it's done, confining a mild COVID-19 patients to the hospital, such patients with no comorbidity is strong, it is considered a low-value medical care and unnecessary hospital confinement. Yeah, it can use up the hospital resources. And outrightly prescribing medications for fever, cough, and colds is considered also a low-value medical care. So unnecessary prescription of medications. Remember, I said outright, okay? So medications only as needed for temperature greater than 39 or above and severe body pain, okay? So prescribed medications only when needed and not outright, because in more than 50% of the time, the symptoms of fever, coughs, and colds spontaneously kusang mawawala with body resistance and immunity built up and maintenance. So I mentioned here, no need for vitamins and supplements. Again, outrightly prescribing vitamins and supplements is considered a low-value medical care, unnecessary prescription of medications. There is no need for vitamins and supplements as long as the patient is prescribed proper nutrition, which I did, balanced, varied diet with plenty of vegetables and fruits. Okay, vitamins and supplements are not indicated. It may cause side effects and entail expenses. So for paracetamol for fever, okay, so 39 and above only. And then what drugs to use? Okay, so there are so many drugs that can be used for high temperature or fever. So listed down there are about 10 or 20. Okay, ibuprofen, aspirin, okay, paracetamol, okay, etc. Okay, but which one is the most cost effective? So using the BRCA table, okay, I just list down the 3 more commonly used in the Philippines: paracetamol, ibuprofen, aspirin. So the question is, which one is the most cost-effective and readily available? Okay, so if you compare the 3, okay, so in terms of lowering the temperature, okay, the fever, paracetamol is effective, but let's say it's only 1 plus 1. Then ibuprofen is stronger, plus 2. Aspirin, plus 2. So stronger, these 2 are stronger, okay, than paracetamol. But in terms of risk, mas konti yung risk ng paracetamol. Okay? Mas mataas yung risk for the ibuprofen. saka aspirin. Okay, pinakamataas. And then in terms of cost, pinakamura yung aspirin saka yung paracetamol, mahal yung ibuprofen. Okay, availability, very available, much available yung paracetamol. So that's why the answer to this question, which one's the most cost-effective and readily available? So the answer here is paracetamol. So ito yung mga complications, no? Prescribing antipyretics with higher risk for side effects is considered low-value medical care. Okay, so pag ang ibuprofen is known for this side effects, stomach upset, kidney risk, allergies, aspirin, thinning of the blood, stomach upset. Okay, so safest pa rin ang paracetamol. So if you are prescribing ibuprofen, no, unless you have a good reason, because you're prescribing a medicine that has higher risk, so you're not doing a high value medical prescriptions. Costlier, ang pinakamahal dito is ibuprofen. Okay, so if you are prescribed the costlier medicine, you're also not doing a high value medical prescriptions. For body pain naman, body pain severe, okay, again, these three can be used for body pain, analgesics, no? So which one is the most cost-effective and readily available? Paracetamol pa rin. Now you can try paracetamol first. Kung di ubra, then you can go to the next higher, which is aspirin, ibuprofen, or even aspirin. Now, but between the two, aspirin has more risk, so you use ibuprofen, okay? So now, for the cough and colds, okay, without trying first the simple home remedy is also considered a low-value medical care because most of the time, the honey and lemon can be effective for cough and colds. Actually, it has been shown that it's very effective, more effective than medications now. Okay, so comparing honey, lemon, and cough, okay, yung honey lemon, it has been shown nowadays, now recent data shows that it's more effective than cough medicines, okay? Then the risk is lesser, the cost is less, and then readily available. So which one's the most cost-effective and readily available? Honey lemon. Again, the same thing for colds, okay? Which one's the most cost-effective and readily available? Honey lemon. So give honey lemon first. Then kung talagang di kakayanin ng honey lemon, then that's the time you can give the cough medicine. Okay. Note that in my regimen, I did not prescribe antibiotics. Okay. Because prescribing antibiotics for a viral, COVID is viral, okay? It's not bacterial infection. It's not indicated. It is considered a low-value medical care. Okay. So we know that this is the most common prescribed antibiotics during the pandemic, okay? Last year, 2 years ago, up to now, okay? So it's not necessary. So prescribing antibiotics for viral infection is inappropriate in the first place, okay? Possible causes will be ignorance of the physician, okay? Not all physicians know everything, okay? Physicians satisfying patients because of the mindset and desire. Kasi sabi ng pasyente, pwede bang mag-antibiotics so? Kasi yung kamag-anak ko nag-antibiotics, ganun-ganon, na? Okay? So, and then physicians' ulterior motive of financial gain, incentivized, or personal basis. Okay, baka may mga medrep siya, may mga rewards siya for prescribing that antibiotics. Okay? So, some more recommendations that I will have. So we know that patients do not know whether there are ulterior motives behind the physician's prescriptions of medications, such as incentivization and personal business sense. Sikreto kasi yan, eh. You don't know about ano yung background ng yung doctor in terms of ulterior motives. So my suggestion is that the best diplomatic strategy to prevent this from happening is just to ask the physicians. Wag mo na sabihin, wag mong tanungin, meron ka bang pharmacy, meron ka bang rewards, but just ask him to present and discuss the comparative data and information on the benefit, risk, cost, availability of the different options. Dapat i-present niya different options and then the data, okay? Okay. Then analyze them, ask him to analyze, let's say he's in a better position to do that. And then after that, you analyze it, the data given to you also, then make a judgment, okay, whether kompleto ba yung presentation ng doktor, baka incomplete, baka, so you can talk, you can evaluate the physicians based on the competency, and then from there you can also sense whether there is ulterior motives or not. No? Okay. So this is the best strategy. Ask the physician to give you the data on the various options, then give them the benefit, the comparative benefit, the risk, the cost, availability. So this is the best attitude that doctors will have when they try to avoid the low value medical prescription, because let's say the patients wanting to satisfy, because patients have a mindset na ganun gusto ko, ganun ganon. Okay? So these are examples of stance of doctors. Yung doctor na magsasabi na, I'm not going to prescribe a low value medication just because a patient has requested it. I think that we need to talk more about it, meaning me and my patient will have to talk more about it so that we can get on the same page. So i-explain na ang doktor sa pasyente. The other statement could be, but when I feel strongly that something has harms, then I guess that I'm less likely to take the patient preference. Kung sa palagay ko, honestly, as a doctor, mas malaking harm over the benefit for a patient who keeps on insisting, gusto ko ito, gusto ko yan, no? Okay, I will not give in, okay? And then the last one is patients should not force me to write down the prescribing pad, in the prescribing pad, what he wants, no? Okay. So another tactic will be, sasabihin ng doctor, I'm sorry your perception on medications for these medical conditions are incorrect and unfounded. Sorry to say that. I have to correct you on this through this explanation. And I'm sorry also that we have to decide on what type of medications to take based on hard evidences, scientific data, and not based on fad and popular practices. So I have discussed the tips already. It's very extensive. Okay, so let me just end with this summary. Okay, I won't read them anymore. Essentially, what I discussed are those listed down here. And then take away in relation to patient empowerment, just to reemphasize, be always in touch with reliable medical information and on the low value and high value medical care. Knowledge is power, it gives power. Use the 4Ks of patient empowerment, kaalaman, kakayanan, karapatan, and kapangyarihan to gain greater control over decisions in the medical management of oneself and promoting high-value medical care and avoiding low-value medical care. So with this, I end my pep talk. I hope I have empowered you to have a better understanding of the importance of low-value medical care or the so-called unnecessary prescription of medications in the management of their health. Next time, I'll be talking about unnecessary diagnostic tests, and the week after, unnecessary operations. Okay. So before we close, as a reminder, please take the online Olete test, okay, to get a certificate. The link is in the chat box. And then 50 Olete certificates will entitle 1 to 1 voucher for a free medical consultation, telemedical. And then now, just a personal request this time, okay? Those who are not planning to take the Olete, which I'm not going to force you, okay? Where in that Olete, I asked for feedback to my pep talk, and I thank those who took the Olete. They have been, the feedback are very good, okay? And I always post it on the Facebook, okay? So for those who are not taking the Olete, okay, I have to hear your feedback. I want to hear your feedback. So please type in your feedback in the chat box na lang in this Zoom, okay? In the open forum, during the open forum while we're still discussing, okay? Before we part ways, okay? Before we close the program. Put down your feedback lang. Thank you very much. So let's now have a group picture taking before we start the QA and interactions. Okay. So, ready? 1, 2, 3. Okay. So the floor is now open for questions, comments, reactions, sharing of experiences, if you have. Although the topics on medications, you can ask questions or comments on anything related to the general topic, low value medical care.
Dr. Ray.
Yeah.
Yes, I typed in a question in the
Okay.
chat box.
Okay. If the patient were an elderly person with comorbidities, would you have prescribed an antiviral drug aside from paracetamol? Okay. So would you have prescribed an antiviral drug? Okay. If the infection is caused by a bacteria, no, I won't prescribe antiviral drugs because it's not effective. Okay. But if the antiviral drugs for the
Same it's a COVID patient also, only the patient is not 30 years old, but an elderly with comorbidities. Would you?
Okay, so the patient has a viral infection. Okay.
COVID, yeah.
COVID. Okay, so you can give antiviral drugs as long as it's proven to be effective, because during the COVID pandemic, a lot of scientists are questioning the efficacy of all these antiviral drugs, diba? Okay, so but if there is a recommendation that you use this, no, then use it for the moment, no? Kasi nakikita mo for the past 2 years nagbabago yung mga antiviral drugs, di ba? Even up to now may bago pa lumalabas, di ba? Okay.
Yes.
So, kung elderly siya because of the risk of a severe infection, then you can give your antiviral drugs, no? Okay. The paracetamol is just parang additional lang yon. That's aside lang yon. Paracetamol is for the fever and also for the pain, if he has pain. No? Okay. So,
yeah.
two separate issues yan. No? So, kung may viral infection siya, you can use the antiviral drug. Okay? If he has, we use only paracetamol for the fever and also for pain. Okay?
Just to give a backgrounder, this is actual experience that I am referring to, because it has something to do with your management, no? The way you were saying to manage, if it were a young patient like 30 years old without comorbidities,
okay,
fever lang, ganon. So that was. But I was just thinking, if it were an elderly patient, like for example, in my case, my parents they're in their 80s, they got COVID, but their symptoms were only cough and cold, no fever even. The doctor prescribed an antiviral drug, which was molnupiravir at the time.
Still being used now, okay.
So, molnupiravir, that was in January of this year. So it was really very effective. It was just I think it was a 5 series. You take it for 5 days lang, and then that's it. 5 days lang. So it was very effective. Siguro when they started taking it after 2 days, parang halos nawala na yung cough, nawala na, pakonti na lang yung cough and the cold. So it was very effective. Yeah. So I'm thinking, like, if it's because they're elderly and because they have comorbidities, but if it were in a younger patient, you would not necessarily prescribe that, correct?
Yeah. because I am assuming that this young patient will recover on his own.
On his own.
Okay, but if there's
Okay.
a high comorbidity, you want to take the safer side, so you can give already. No? So, but you can give the antiviral drug no, for the virus, di ba? Okay.
Yes.
So,
So
yung mga symptoms ng fever, this is a side effects of the viral infection, no? Okay. So
walang
it's
fever nga sila eh.
yung cough and cold. So it's a
Cough and cold lang.
no, side effects of the ano yan effects ng mga upper respiratory tract but caused by the COVID, di ba?
COVID.
So if you control the virus, then eventually the cough and colds will disappear also. No? Okay. So you don't need the so yung paracetamol is actually so he doesn't need wala siyang fever so he doesn't need paracetamol, di ba? Okay. So you don't have to give paracetamol. Okay. So but what I'm saying because from your question kasi kino-compare mo antivirus and paracetamol no? Magkaiba 'yon, di ba? Okay.
No, no. No, I wasn't I didn't mean it that way. Sorry. I didn't mean it that way.
Okay.
I'm just saying if there was also a fever present, the only difference is that it's the age
Yeah, the age. Okay.
and having comorbidities.
Okay. I have actually months ago I have discussed the an issue on fever and paracetamol, di ba? Okay, last January, no? So what I'm
Yes.
saying also, you don't just outrightly give paracetamol for temperature, let's say low grade, no? Or just yung first few days lang, wag mo munang bigyan, no? Okay?
Mm.
Let it stay there. No? Kasi it's protective eh, no? So if you give you anti-pyretic like paracetamol, you abolish the fever right away, di ba? So that will create more complication, no? Okay? Yan ang thinking eh. Ngayon, if you're aware of the new study now, new study that will parallel what we are saying about paracetamol. Paracetamol kasi we told you not to give it right away, di ba? Okay, let the fevers work on its own kasi it's protective also eh, di ba? So yung bagong study ngayon, di ba madalas tayo nagbibigay ng mga NSAID, yung mga mefenamic, yung mga what do you call dolfenal, no? Gano'n yung mga for the pain. Constant, gano'n, no? So it has been shown that you do not use that, no? Kasi effective nga siya, no? Malakas siya, no? Pero in the long run, mas maraming complication, no? Kasi pag binigyan mo kagad ng ito yung mga NSAID, mga Dolphinal, Ponstan, you remove the inflammation part right away, no? Okay? And then pag tinanggal mo na yan, parang yung protection yan nawala na, no? Okay? Kasi natanggal mo na, no? So you give paracetamol first, no? Okay? If there's let's say some pain in the patient's body, you start with the so-called when you say paracetamol, it has no anti-inflammatory action, no? Okay? Yung Dolphinal, yung mga Constant, no? May mga anti-inflammatory. Tinatanggal mo yung inflammation kagad, no? Okay. So, now studies are just about 2 weeks ago nabasa ko lang. Sabi ko, okay, maganda ito, no? So, it's coming out now. Don't give the Pons kasi tayo pag may pain right away, Ponstan, di ba? Ganon. Okay. So, you can use paracetamol first. Use paracetamol first, no? Rather than yung Ponstan, Dolphinal, etc. Okay. So this principle is the same as the fever. Huwag mo tanggalin yung protection ng fever. No? Okay. Okay.
Thank you.
Okay, there is another question from Angelina Tanyola. Let's all welcome Mrs. Tanyola because this is her first time here in PEP Talk. The question is why vitamins and supplements are not necessary to take.
Why vitamins or supplements are not necessary to take? Because you have enough vitamins and supplements inside your body. So you take it from the natural foods lang. Okay, Lina, you can take it from the foods. I had a lecture on that also during the first part. No, okay. Number two, yung mga vitamins are synthetic usually. No? So yung absorption is not reliable. No? Okay. Number three, it can, kasi mga synthetic ito, it can also cause side effects. No? May mga side effects yan din. Yung mga high dose na vitamin C, no? May mga side effects din yan. No? Vitamin E, no? Ganun, no? Okay. So go natural. No? Natural. As long as you're eating enough, no? Healthy diet, adequate balanced diet, no? You have enough vitamins and supplements there to take care of your body. No? At age 73, 74, going 74, I've not taken vitamins and supplements. Okay, did I answer your questions?
Thank you for that information.
Okay. Any more?
We have the chat box.
I would like to thank you, Doc, and at least we were informed about the risk, the availability, and also the
Cost.
cost,
Yeah.
everything about the and also the effects of the antibiotic.
Yeah, okay.
We usually, once the doctor prescribes, we usually take without even telling us about the risk of taking this antibiotic.
Yeah, so
So
ang
thank you for that.
ang pinaka-ideal is a doctor explaining everything. The benefit, what will be the action, what will be the expected outcome, no, when you take it, and then what are the potential side effects, sasabihin din sa'yo, sasabihin sa'yo, ano mga warning sign, no? Okay. And then sasabihin sa'yo that what to observe, no? Then how long to take it, wag tuloy-tuloy, no? Pag hindi na kailangan, tigil na, no? Ganon, no? So, pero pag in-explain yan, matagal yan, di ba? So it will take a lot of time explaining, but they should do it, no? They should do it, no? Okay. Any more questions?
At the chat box.
Dana?
Is there any session after this? Another session?
Yes.
Yeah, the next session, actually, okay. The session for the pep talk will go on indefinitely for the moment. There's no call to stop it. No? This is actually the 50-second pep talk. No? Okay. So unless I get sick, unless I get crippled, then we stop. No? Okay. Okay. So the next session will be on, as I said, the second type of unnecessary low value care, no? Which is diagnostic test. No? Okay. Diagnostic test this time. No? And then the third one will be on operations. No? Somehow it might reflect on your case. No? Okay, unnecessary operations. Diba? Okay. So after that, I still don't know what other topics I'm going to pag-isipan ko pa. May request naman si Fusta. I'll think about it. Okay.
It's okay, Doc. I'd like to share something.
Sure.
Yes. This was pre-pandemic. My usual case, my throat is always inflamed, so I went to a doctor. Luckily, the doctor told me, okay, so I had pus again at that time. I had pus on my tonsils, so I had to be prescribed antibiotics. And then she did this prescribe paracetamol. She said, if you have a fever, if your fever shoots up, then you take it. But she did warn me about so until now, I took it to heart. So if I have the occasional headache, I do not take any paracetamol at all because I'm very aware of it counteracting the effect of my maintenance medicine. So I learned something from that doctora, which is very helpful. Kasi when I was young, I'm konting headache. Oh, you take, biogesic, take half an aspirin. Now I don't anymore. I use cold compress on my head.
Halo.
I talaga. No, at least taking tension medicines. Don't be a slave to painkillers because they counteract pala. They counteract the effect of our hypertensive medicines.
Yeah.
Yun.
Okay. Kung saan taking medicine unnecessarily. Baka hindi naman kailangan. Di ba? Okay.
Yes.
Ang gagawin mo na lang, just like in the laughing exercise, in your brain, and then kalug-kalug mo lang, mawawala na yung headache mo.
Sana pa.
Okay.
There
So,
is a comment from Jacqueline Tong. Good tips to determine how the doctor is managing us. Sometimes we take his or her word as gospel truth. Thank you.
True.
Also from Mrs. Sinaida Cabral. Happy Father's Day, Doc.
Oh yeah, Happy Father's Day.
malapit na pala. Okay. Kailan yun?
Oh, bukas po.
Bukas. Okay.
Bukas. 18.
From Rochelle de la Cruz. Thanks, Doc, for another informative session. As a patient, whatever the doctor prescribes, that is what I follow. The pep talk has helped me realize to follow the weight and observe first before taking any medication.
Okay.
And from Mrs. Angelina Tanyola, maybe this is a request from her. Topic, cancer prevention.
Okay. Now, okay. So, itong mga topic that you're suggesting, okay. Number one, I'll just give you the list of the lectures that we had already. Now, so may tape recording naman doon eh. No? So we don't have to repeat it yet. No? Okay. So we had this lecture already before. No?
Yes.
Cancer prevention. No? Okay. So, okay, just one last word. No? Okay. Actually, when I was preparing this lecture, ang title is unnecessary operations, unnecessary medications. Then when I was looking at the internet, now I came across this movement. They call it low value. Now, low value. Okay, there's another, parang mas diplomatic siya, di ba? Mas euphemic, no? Low value. So I just adapted it, but it's now a movement all over the world, no? Except yung Philippines, di pa nagpipick up, no? Okay. So with this one, I think I'm not going to say that I'm the first, di ba? Okay, I'm trying to create awareness now on the low value medical care, no? Kasi naisip ko rin kahit na pinasa yung universal healthcare law, no? They're going to use the PhilHealth. Sabi ko, it won't be successful if we cannot control the doctor's prescription. Okay. Mauubos yung pondo, no? Okay. So I've been telling my friends before, kung yung the universal healthcare law, hindi magiging successful yan if you don't, nakalimutan niyo yung how to educate the doctors, di ba? So yun, no? So, but as I said, it's hard to educate the doctors now. So the better way is to be empowered na lang kayo, no? Okay. Be empowered and know your rights, karapatan, kapangyarihan, etc., etc. No? Okay. So with that,
Wait. From Susan Tan, informative session, thanks. And there is another one from Mrs. Angelina Tanyola. There is an article that vaccines are not safe.
now yung mga ganon, when you say, you don't make a general statement, no? Everything that we do on this world, everything that we eat, even the foods, everything, all the medicine usually may benefit and harm yon. So ibabalance mo lang, no? Okay. Kung mataas ang proportion ng harm, don't take it. But example doon sa COVID, no? So yung mga anti-vaxxer, they're afraid of it's unsafe, no? But we know there's a certain percentage of side effect, no? But yung benefit outweighs it. mas mabigat yung benefit. Kaya we took it, di ba? Okay. So no such thing as 100% safe and 100% perfect, no? Okay. May possible risk in everything. So ibabalance lang palagi, no? Okay. So no more questions. We will call it a day. The next topic will be unnecessary diagnostic test, no?
Yeah, from Jocelyn P. and from all of us, Happy Father's Day.
Thank you. Thank you. Bukas ba yun?
Happy
Bukas.
Father's Day.
Yeah, tomorrow.
Bukas na.
Father's Day, Doc.
Okay, thank you.
Father's Day po.
Happy Father's Day.
Father's Day, Doc. Bye.
See you po,
Bye-bye.
Doc.
Bye-bye.
Bye.
Bye.
Bye-bye.
Bye.
See you.
Bye-bye.
Bye. Bye po.
Bye-bye. See you.
See you.
Ano ka na sa
Hindi. Kailangan yun sa ano?